Hi, hello friends, and welcome back to my YouTube channel, Nursing Success Nursing Academy. In the previous classes, we have seen about the uterus, the fallopian tubes, and in our today's class, we will see about the ovary. I request you to subscribe the channel and share and like the channel. We will begin with our introduction of the ovary. We all know what are ovaries. Ovaries are the paired structures, and these are the primary female sex organs and also called as a parenchymatous organ, as they are called parenchymatous organ because they are filled with the tissue. And this ovary is a word which is derived from the Latin word known as the ovarium. What is the meaning of the ovarium? The meaning of the ovarium is a egg or ova, or we can also call it as secondary oocytes. Now, what is the function of the ovaries? The function of the ovary is the production of the hormones and the production of the female gamete, that is the ovum. Next, where are these situated? Where are the ovaries situated now? They are, and also the shape of the ovaries. The shape of the ovaries is said to be oval shaped or also the almond shaped, we can say, and these are located on the either side of the uterus. On the both the sides of the uterus, these are located. These are located, that is each one side, on left side and on right side of the lower abdomen. Now, what is the measurement? What is the how? What is the length? What is the breadth? And what is the thickness? That is, they measure about 3 centimeter in length, 2 centimeter in breadth, and 1 centimeter in thickness. So each ovary is around 3 centimeter into 2 centimeter into 1 centimeter, and they are weighing about 2 to 3 grams each. So the weight of each ovary is 2 to 3 grams each, and they are connected through the pelvic wall with the help to the uterus by the ligaments. For they are how the ovaries are connected. Ovaries are connected to the pelvic wall and the uterus by the help of the ligaments. We will see which all the ligaments are there in the coming slides. So here is a cross section of the ovary. Here we are seeing the how the in the ovary how the follicles are getting matured. Now, this is the structure of the ovary. The structure, as we said, this is a ovary is a parenchymatous tissue. Okay, and this is having mainly two parts. That is, we can say it as cortex as well as medulla. Here in the picture, you can see the outer part of the ovary, the outer part of the ovary where I am moving the cursor. This part is the germinal epithelial of Waldeyer. Okay, this is the surface layer of the ovary, and just below the surface layer, a layer known as tunica albuginea is present. Just below this layer, a layer known as tunica albuginea is also present, and the part which we are seeing here, with the part in which the cells are seen, this part is the cortex part, and this is the hilum part where I am moving the cursor. This is the hilum part, and here from here only the blood vessels and all are entering, and here inside this where the blood vessels are entering, that part is called as the medulla. Now here in the picture we are seeing there are some cells, these small cells, these are the primordial follicle cells. Okay, and these primordial follicle cells, further they are what they are becoming, they are becoming the primary follicles. Okay, this primordial follicle cells, they are producing a hormone called as estrogen. Okay, and this they further become the primary follicles. That is, they are when they are becoming the primary follicles or the primary, further they become the primary oocytes. Thus, primary oocytes, these primordial follicles are present before the birth of the baby. Inside the intrauterine only, these primordial follicles will be already present in the womb of the mother only when the baby is there in the mother's womb. Okay, so here when the primary oocyte is there, the primary oocyte, it is when the baby in the mother's womb is around 20 weeks, or we can say it as 5 months. That time how many will be there. Around 50 to 70 lakhs or 5 million primary oocytes will be present in the ovaries. Okay, and at birth, these primary oocytes, the number will be 2 million, and at puberty, they will become 4 lakh, of which only 400 oocytes will be there, and at menopause, they will be less than 10,000. Okay, so this is what is our primordial follicles. From the primordial follicles, they become the primary follicles. From the primary follicles, further, when the time is taken, then they become the primary oocytes. When the primary oocytes starts getting matured, they become the follicular cells, in which there is the presence of some follicular fluid. Okay, on this one there are presence of cells known as the granulosa cells. Is that clear? And when these granulosa cells get arranged, there will be a fluid filled cavity, and that particular cavity we are calling it as antrum. Okay, this is what is our antrum when we are it is a follicular fluid filled. Is there? Then further these cells, okay, these cells again multiply, and finally what happens, a follicle is formed, and that is the mature Graafian follicle. As we say, which is the functional unit of kidney, nephron. Similarly, the functional unit of the ovary is the follicle. Okay, here further when we go here, what happens, the this primary oocyte when turned into a syndrome, and that is the mature Graafian follicle at a particular period, that is known as ovulation, when the ovum or an egg, or we can say, or a ova hatches and comes out. So this is the ovulation. This period is called as the ovulation. That is after the release of the secondary oocyte. This is the primary oocyte, and after the primary oocyte, in the picture it is not shown, but there is a secondary oocyte will be released. And when the secondary oocyte, this is the secondary oocyte, from here it is coming, and this ovum is released. This is the primary oocyte, and this is the our secondary oocyte, and here there is a release of the secondary oocyte. When this secondary oocyte is released, this remaining portion where I am moving the cursor, the remaining portion is known as corpus luteum. So here this is the corpus luteum. So what is this corpus luteum now? This corpus luteum, as it is in the picture also yellow colored, it is a yellow colored one. The corpus luteum color is what? Yellow colored, and the hormone produced by this corpus luteum are four hormones, four major hormones this corpus luteum producing, that is the progesterone, the estrogen, the inhibin, and relaxin. In case this corpus luteum, if there is no any fertilization of this ovum, then what will happen? This corpus luteum shrinks and becomes white in color, and that is known as corpus albicans. Okay, so this is what is the how the mature follicles are getting matured, and how is the ovum is released, that is the ovulation, and the corpus luteum, and what are the hormones of the corpus luteum. Next, as I said you, the medulla is there, and from the medulla there is the blood vessels, veins, and lymphatic drainage is also there. The next slide we will see. Okay. The structure I was telling you about, that is the germinal epithelial, the outer layer of the cell, that is it is having the simple squalor cells, and tunica albuginea, I said that is a connective tissue capsule, white connective tissue capsule, and the stroma is there, that is the connective tissue which is being divided into two types, that is the inner medulla and the outer will be the cortex. So now what is medulla? Medulla is a supporting framework. Inside the medulla, what all the things are there? It is made up of the fibrous tissue, loose connective tissue, and it is having what? Ovarian blood vessels inside it, and lymphatics and nerves also travel through it. And the next part is was what? The cortex. As we saw, I just in the previous slide we saw about the picture. Na? where the follicles were present of different stages. So that part is the cortex part. Here what is happening? They are containing the oocytes of the various developmental stages. They are the functioning part of the ovum. And there are also single layer of the follicular cells and several layer of cells, and the several layer of the cells are known as the granulosa cells. And I already discussed with you, Fecal, once the mature follicle is there, that is the Graafian follicle is mature and it is large in size and full with a fluid is filled inside that follicle. And once that Graafian follicle will rupture, the secondary oocyte or the egg or the ova will be released, and that process is known as ovulation. And after the ovulation, the remnant of the Graafian follicle is called as what? Corpus luteum, which is producing what? Estrogen, progesterone, relaxin. Uh, when? Until it is getting degenerated. Once it is degenerated, it is called as Corpus albicans and it is white in color. तो अभी हम उसके नेक्स्ट हम देख रहे हैं रिलेशंस के बारे में. एंटीरियरली ओवरीज के लिए क्या है? ब्रॉड लिगामेंट्स है. पोस्टीरियरली ओवरीज है. ओवरीज के लिए इंटेस्टाइन है. और लैटरली ओवरीज में क्या है? इन्फेंडिबुलोपेल्विक लिगामेंट्स है एंड साइड वॉल्स ऑफ द पेल्विस है. सुपीरियरली टू द ओवरीज द यूट्राइन ट्यूब्स है एंड इंफीरियर टू द ओवरीज ओवरियन लिगामेंट्स है. नाउ अभी हम लिगामेंट्स के बारे में देखेंगे. अपन ने अभी ओवरी का लिगामेंट्स के बारे में हम जानेंगे. ये लिगामेंट्स क्या है? व्हाट आर दिस लिगामेंट्स? लिगामेंट्स आर द सपोर्टिंग स्ट्रक्चर्स. जैसे ये ओवरीज और ये यूट्रस ये जो पेल्विक कैविटी में रहेंगे, तो इनको साइड और मीडियल और लैटरली इनको बेंड होने से इनको रोकने के लिए और इनको खींच के रखने के लिए जो हेल्प कर रहे हैं, उनको अपन क्या कह रहे हैं? लिगामेंट्स कह रहे हैं. तो यहाँ पे हमारे ओवरी में 3 लिगामेंट है. एक तो मीसोओवेरियम लिगामेंट है, ओवरियन लिगामेंट है, सस्पेंसरी लिगामेंट है और उसको दूसरा नाम भी कहते हैं इन्फेंडिबुलोपेल्विक लिगामेंट भी कहते हैं. ये मीसोओवेरियन लिगामेंट है. ये कहाँ पे है? ये पोस्टीरियर साइड ऑफ द यूट्रस में है. दैट इज इन द डबल फोल्ड ऑफ द पेरिटोनियम. और ये कैसे हेल्प करता है ओवरी को? ये पोस्टीरियरली डिविएट होने से ओवरी को प्रिवेंट करता है. सिमिलरली ओवरियन लिगामेंट जो है वो क्या करता है? ये कहाँ से इनिशिएट हो रही है? So I was speaking about the ovarian ligament. In the ovarian ligament से कहाँ से initiate हो रहे हैं? Initiating from the lateral wall of the uterus and it is attaching to the ovary and it is preventing the lateral deviation. Laterally deviate होने से क्या कर रहा है? Prevent कर रहा है. Similarly with the suspensory or the infundibulopelvic ligament में क्या है? एक lateral wall से initiate हो रहा है and ये कहाँ पे attach हो रहा है? Pelvic attaches to the pelvic and it is preventing the lateral deviation. So these are the 3 ligaments. ये समझ में आ गया? समझ रही हूँ मैं आप लोगों को. 3 ligaments है, mesothelium, ovarian ligament and the suspensory ligament. हमने अभी ओवरी का स्ट्रक्चर देखा. हमने ओवरी का लिगामेंट्स देखा और ओवरी में जो फॉलिकल्स जो हैं वो कैसे मैच्योर होके वो कैसे ओवम रिलीज कर रहे हैं, ये भी प्रक्रिया हमने देखा. अभी हम नेक्स्ट देखेंगे इसका डेवलपमेंट कैसा है. ओवरी का डेवलपमेंट कहाँ से हो रहा है और कैसे हो रहा है. जैसे हमें मालूम है कि जर्मिनल लेयर्स जो रहते हैं वहाँ की एक लेयर जो है मेसोडर्म लेयर, वहां से क्या हो रही है? हमारी ओवरीज फॉर्मेशन हो रही है. ओके. जब 3rd वीक में योग सैक बनती है, माँ जब प्रेगनेंसी का 3rd वीक में जो योग सैक बनती है उसी समय क्या होती है? प्रिमोडियल फॉलिकल्स ऑल्सो चालू होते हैं. प्रिमोडियल फॉलिकल्स ऑल्सो स्टार्ट. और यहाँ पे क्या होता है? ये मेसोडर्म लेयर जो है यहाँ पे 2 लॉन्जिट्यूडनल रिजेस बिगिन होते हैं और जब 5वां हफ्ता खत्म होता है तब ये प्रीमोडियल फॉलिकल्स कहाँ पे रीच हो जाते हैं? जेनिटल रिज और गोनाइडल रिज में रीच होते हैं और वहीं से क्या होता है? ओवरी का डेवलपमेंट स्टार्ट होता है. that is the ovaries are from where they are developing from the medial part of the genital ridge or the gonadal ridge. ये गोनाइडल रिज से हो रहे हैं या जेनिटल रिज से हो रहे हैं, पर इसके पहले का प्रक्रिया मैंने आपको बताई. So at about the 4 week of the gestation, that what I told was the yolk sac वगैरह बनना, तो उसी समय में क्या होते हैं? प्रीमोडियल सेल्स भी क्या होते हैं? वहां पे बनने लगते हैं. ओके. फर्दर ये क्या होने लगते हैं? दे आर माइग्रेटिंग टू द गोनाइडल और द जेनिटल रिज. तो फर्दर क्या हो जाते हैं? ये जब ओवरीज वहां पे बनने के बाद ये क्या होते हैं, एक समय के बाद ये ओवरीज क्या होने लगते हैं, ये डिसेंट होते हैं। ये डिसेंट कहाँ पे होते हैं, एब्डोमिनल कैविटी में होते हैं। एब्डोमिनल कैविटी से कहाँ डिसेंट इन द एब्डोमिनल कैविटी विद द टू लिगामेंट्स है। ये कैसे दो लिगामेंट कौन सी है इसका, एक तो सस्पेंसरी लिगामेंट है और एक इन्फंडिबुलो पेल्विक लिगामेंट है। ये दोनों लिगामेंट्स कौन सी लिगामेंट के ब्रांचेस है, जेनाइटल लिगामेंट के पार्ट्स हैं। जो एक जेनाइटल लिगामेंट रहता है, वो जेनाइटल लिगामेंट को क्या है, उसको दो भाग में बांटा गया है, एक कॉर्डल पार्ट है और एक क्रेनियल पार्ट है। क्रेनियल पार्ट का ही आगे चल के वो सस्पेंसरी लिगामेंट बनता है और क्रेनियल पार्ट चल के क्या बनती है, फर्दर चल के वो राउंड लिगामेंट बनती है। इन दोनों लिगामेंट की सहायता से वो क्या हो जाती है, एब्डोमिनल कैविटीज में ओवरी आते हैं। ये एब्डोमिनल कैविटी पेल्विक एब्डोमिनल कैविटी से ये फर्दर कहाँ आते हैं, पेल्विक कैविटी में। तो ये पेल्विक कैविटी में आने के लिए जो कारण है, फ्रॉम व्हाट इज द रीजन बिहाइंड दिस, how the ovaries are coming from abdominal cavity to pelvic cavity with the help of these two ligaments. And what is the reason behind this, because of the abdominal pressure and because of the ligaments, these ovaries are coming to the pelvic cavity. Okay, so next we will see what are the blood supply for this ovary. That is, the artery supply is the ovarian and the abdominal aorta, and the venous drainage is to the ovarian vein. And in the venous drainage also, left side is directly to the ovarian vein, and right from the ovarian vein it is going to the renal vein, and then it is going to the inferior vena cava. But the right sided it is directly putting to the inferior vena cava. आप ये बात समझ लीजिए, लेफ्ट साइड की ओवरी जो है वो ओवरियन वेन में जाएगी, ओवरियन वेन से कहाँ जाएगी, रीनल वेन में जाएगी, और वहां से वो कहाँ जाएगी, इंफीरियर वेना कवा में जाएगी। पर राइट वाला जो है वो डायरेक्टली इंफीरियर वेना कवा में अपना वेनस सप्लाई डालती है, और नर्व सप्लाई ओवरियन प्लेक्सस से है। Okay, so and I already also said about the functions also. Function is the formation of the secondary oocyte egg or the ova, or the hormone production. ओवरी में कौन सी हार्मोन्स प्रोड्यूस होती है, एस्ट्रोजन, प्रोजेस्ट्रोजन और प्रोजेस्ट्रोन। ओके, एंड इवन वहाँ पे कार्पस लुटियम से सम अमाउंट पे रिलैक्सिन और इन्यूलिन हार्मोन्स भी प्रोड्यूस हो रहे हैं। ओके, आई होप सो यू अंडरस्टैंड अबाउट द टॉपिक, and if you anything you have any doubts and questions, you let me know in the comment box.